today's expert in their field.
Hey, good afternoon. We have a beautiful, pretty soon going to be rainy day. I got to tell you, today's show, Ask the Expert show today, is something special. Mainly because I am involved with this. I am the test case. Yes. Today's show is about anti-aging. And I got to tell you, I had such a completely different feeling about anti-aging when it comes to hormones. Mm-hmm. So let me introduce you. And I don't even know what your title is, but we talk almost every day. Let me introduce you to Tina Montoro of AAI Rejuvenation.
Yes, I'm the clinical director there. And basically, I just oversee and make sure our patients are getting the best care possible. So I deal with the pharmacies and the doctors and things of that nature.
And people like me who've got 1,000 questions.
Yes.
And we're going to go through the whole gamut today. And we say anti-aging, but this can also help younger people who have low testosterone.
Mm-hmm. Absolutely.
And we're going to talk about anti-aging for women also today.
Mm-hmm.
I've known about this therapy probably for the last 20 years. I did not want to do it for one reason. I did not want the injections. There was no way, and I didn't even know that some of the injections you get in your stomach, but I used to watch my father who had diabetes, and when I saw him give himself these shots in the stomach, I went, no way. So I already had a block in my head. Anti-aging, great, as long as I didn't have to do the hormone injection, and that's part of the program. So when I met Dean, who's the owner of the company, Dean and Dana, and he told me about what it did for him, I got excited. And so I said, I've got to try this, and I'm just going to be a small person. See, it's what happens when you have a live show. When you have a person that is afraid of needles like I used to be. So let me just start off. The first thing you do if you decide to go on this program is you have major lab work done, blood work done.
Yes, absolutely.
And just, it's really important to me because I found out things I didn't know that were going on in my body, that it was really a good thing because I found out I had some liver problems. And I don't even drink. I've never drank in my life, but I had some liver problems. I had some triglyceride problems. And, of course, my hormones were completely out of whack. But I would not have known this, so it almost forced me to get this blood work. And that's the first thing you do, is the blood work.
Absolutely. A lot of patients that come to us have never had their hormones tested. Never. So they were already coming to us with a slew of symptoms, and we really don't know where their levels were at when they were healthy.
Because they didn't know what their testosterone was.
They didn't know what it was, yeah. So that's amazing.
So when you have low testosterone, what does that mean to your body?
Just basically you have no energy, you have lack of sex drive, lack of focus. You know, it's harder to make those gains in the gym when you do go. Your sleep is affected. It really affects all areas of your life. A lot of the patients that come to us too are depressed. Very depressed. A lot of them are even on prescription medications.
For depression
that cause even further problems with their libido and sex drive. So it's amazing what the program can do for them.
Now, was my high blood pressure, was that related at all to my low testosterone?
With any type of medical condition or problem, the doctor reviews it per patient case. Okay. So there's some people with high blood pressure that the doctor doesn't treat, and there's various reasons why. Some patients that, are monitored and are put on prescription medication and their blood pressure is under control and they're being seen regularly by a physician, then the doctor will be able to prescribe a treatment for them. So it really depends on the patient's specific symptoms and medical history, family history, and things of that nature.
And you have doctors on staff. You have some really fine doctors on staff.
Absolutely.
And I actually met with one of them, and he actually did a physical on me. But I didn't think I would be eligible with high blood pressure and some of the things. But it was okay.
Turn this off.
We're going to
turn that off and throw it away.
Just turn it off. You're a very popular woman.
A little bit.
Your patients are calling you. So then I find out the things that are wrong. Went to the doctor, got this physical, And then it was time, the program that you put me on.
Mm-hmm.
I got to tell you, it was a box sent to my house, and we opened it. And I was with Dean and Dana, and you were there too. I got to tell you, I was like, oh my God, because there was so much. Because you don't do, it's not just injections, there's also supplements too.
Absolutely.
I'm taking like 4 or 5 different supplements, but these are high grade supplements. Is that right?
Absolutely. You can only get them through a physician. They're prescription grade supplements. So all of the raw materials are very pure. They're tested. I think they have 2 ISO certifications, which a lot of supplements do not carry. A lot of the supplements can actually be toxic for you. So we only use the best supplements, and that really helps to minimize the patient's symptoms and also maximize their benefits while on therapy.
Well, I got my first 2 injections that day. Because 2 of the injections I take during the week are in my tush. And I got to tell you, they don't hurt at all. I was like shocked. I said, that was the biggest needle between the other one that I take in my stomach. And I got to tell you something, the one in my stomach, now I see why my father had no problem doing it. You don't even feel it. You literally don't feel it. I'm giving it myself. I'm taking supplements every day. So a lot of people think that when you go on a hormone replacement therapy, it's about losing weight. And we're going to talk about that today, too. I have lost 12 pounds. Now, I have a lot to go, but I've lost 12 pounds in 3 weeks. I got a great story for you.
That's so good.
So I went and bought some shorts. Haven't bought shorts in years. I'm not going to tell you the size I always buy.
Okay.
Went in there. It's the same brand, everything. I bought the shorts into my week and a half. They were literally falling off of me. I had to take them back to the store, get the next size down, and those are a little big on me. And I used to tell people, because I was a nutritionist for many years, don't necessarily go by how you look, go by how your clothes fit you, because it's a very slow process when you're losing weight.
Absolutely.
So that was the first thing I noticed. Then I think I told you I went to the gym. The electricity was out. That means no air conditioning. Yeah. So I was good. And I said, you know what? I'm going to work out. I was ready to work out. There's something when you get on a program like this mentally that makes you just want to go out there and do more. I worked out for 2 hours, no electricity. I mean, can you imagine how hot it was in there? And I was like so proud of myself. My strength in the gym, I can see it's completely different.
Absolutely.
I have sleep apnea. And I got to tell you, I've been sleeping through the night for about the last week and a half. It's never happened for me. So when we're going to talk today, it's not just about weight loss. There's so much other benefits to this. And you're right, you do focus better.
Absolutely.
I do a morning show. You have to be focused. And sometimes the show gets a little crazy and I'll go into whole nother world. I have been able to stay focused. So there's so many benefits. And from what I understand, this is only my 3rd week. I'm on a 3-month regimen. And I cannot wait. Each week I look so forward. And this is no sales pitch, because one of the things, I don't know if I was Dean, if I would have wanted to do this, because it's really, what if it didn't work on me? I mean, nothing's 100%, right?
No, it's not. It really depends on the patient's ability to change their eating habits, incorporate the right nutrition and stay on the program. It is a commitment, because, you're not going to just take the medication and have all these benefits. You definitely have to incorporate all of those factors.
Let me tell you about the diet. Diets are very difficult. Anyone who's ever been on a diet can tell you it's hard to stay on a diet.
Yep.
You might do really well for weeks, maybe even months, and then you go that day, well, I'm going to eat this because I can always start back tomorrow.
Yeah.
And tomorrow sometimes doesn't ever come. And when you put weight back on after a diet, you get more.
Oh, absolutely.
Let me tell you why this has been easy for me. There's something mental about this.
Absolutely.
That when you're doing these injections and you're doing these supplements and you're working out, it's like it's almost like a taboo. Like you don't want to eat anything bad.
Absolutely.
I actually had a friend of mine who weighs 390 pounds, and he listens to my show every morning, and he said, "Oh, anybody can do it. Just go on a 500 calorie a day diet." It's impossible.
Yeah.
That is totally impossible.
It's hard, but it's not healthy for you.
No,
we
not
really
healthy
don't
for you.
We don't promote those types of diets. Yeah.
No, but now we're going to talk about your position.
Okay.
Because when I got, the needles and the supplements, and you're looking at it's overwhelming. First thing you do is you send out a package. And it is a great package. It tells you 7 days what you need to do.
Exactly.
So, but the problem is when you're looking at all these different types of supplements and the different, the testosterone, it's like,
it's a commitment.
Wow, am I supposed to do? And I would call, and you were actually my representative, my clinical representative. And I got to tell you, you made me feel so relaxed, like I wasn't asking a stupid question.
Never.
And it was, you could not do enough to help. And I've noticed, because when I come over to the clinic, I've noticed the whole staff is like that.
Yes, very much so.
So your customer service is amazing.
Yeah. Our advisors are available even at nighttime. You won't find that with your regular primary physicians. They'll answer the phone at 9 o'clock at night if that's the time that you have to do your injection. And all of a sudden, you have a question. We want to make sure that everybody's available to answer those questions for you right away. We don't like waiting till the next day and things that,
Well, I think the customer service is so important, especially when you're first starting. Now, you haven't heard from me in about a week.
I knew you were doing
because, I kind of got it down now. The one thing I had was, I should have done this from the beginning, is get a calendar, because sometimes you'll go, wait a minute, did I do that yesterday or was that the day before?
Yeah.
So let's talk about someone. Let's give out your phone number, first of all.
Okay, absolutely.
Give out your phone number.
Okay.
And I know your website. You can actually go to your website right now at www.AAIClinics.com.
Yes.
You can actually watch our show today. It's on your website, or you can watch the station's website. But when a person walks in, what's the first thing you do? What is the first thing that happens when they come to your clinic?
The first thing that we need to do is get the lab evaluation. Like I said, many patients come to us never having their hormones tested. So we need to make sure the correct panels are tested. We'll send the patient for lab work. We require a full physical exam, so we make sure that the patient is, in good condition to be treated. And they also have to provide an extensive medical history in terms of their family history, any surgeries they've had. The doctor really evaluates everybody on a patient-specific basis. So those are the main requirements before we even start thinking about what treatment we can offer, because it's very tailored to that person.
Got to be truthful too, don't you?
Absolutely.
Because some people want to go on the program so bad, but they're afraid, well, if I tell them this, they might not let me go on the program.
Absolutely.
What is the difference in what I'm doing, and you hear about these athletes who take steroids?
It's so different, because what we're doing, we're therapeutically providing doses that are just going to treat deficiencies. So they're very low doses and they're very scheduled. That's why you have medications on day 1, day 2, day 3. It's a process. So we're not trying to, overwhelm the system and, get these really, really high doses where the levels are getting, very, very high. And that's what athletes are trying to do. Obviously, they're doing it for different purposes.
And they buy them off the street, too. And whereas there's not a doctor overseeing, where your program, there's not just one, there's several doctors that are overseeing.
Exactly.
So that makes a lot of sense. We're going to go to break. If you have a question you would like to ask Tina, you can give us a call here at 888-565-1470. That's 888-565-1470. Or you can go to AAI's website at www.AAIClinics.com, and you can actually watch today's show. We're going to go to break, and we'll be back with more.
When it comes to age management, the name you can trust is AAI Rejuvenation Clinic. Their daily reviews rate them the highest in South Florida. AAI Rejuvenation Clinic is here to provide new and unique information about testosterone therapy that will further enlighten you. Increasing your testosterone helps you perform better in the bedroom, increases your strength, as well as keeps you more alert. By age 30, 93% of men have begun some level of testosterone declination. Don't wait until you have obvious issues before deciding to correct them. It's much better to reverse issues that have rooted over time. AAI Rejuvenation Clinic offers HGH injections, which will help you to lose weight, lower blood pressure, and give you that young overall feeling again. You can expect HGH injection therapy to return your metabolism to rates and speeds that you experienced in your youth. Feel free to contact one of their wellness advisors to discuss your questions regarding growth hormone, GH therapies, and whether they are right for you. Call now at 844-438-4781 or go to their website at www.AAIClinics.com.
And we're back. I love doing this show mainly because I am so into this. I cannot believe I waited so many years because I was afraid of needles, and I was kind of afraid to find out maybe what my blood work was. A lot of people are. They don't have blood work done because they feel like if they don't know, then they don't have to worry. But boy, that's just not the case.
No.
So let me give the phone number out for AAI. It's 844-438-4781. That's 844-438-4781. Or you can go to their website at www.AAIClinics, that's plural.com. And this is not just an age thing that I'm finding out, because I've had sleep apnea for probably 12 years. And I used to be, even with the mask that I wear, I would be really tired in the mornings.
Yeah.
When I would get up, it was like, I don't want to get up. I mean, I was exhausted. I don't have that exhausted feeling. Mm-hmm. So one of the things we're going to, and you'll be with us every month, one of the things I want to get across is this is not just for a diet program.
Mm-hmm. Absolutely not.
There's so much more to it than about losing, but the nice thing is that you do lose weight. Mm-hmm. And if you are a male watching or listening to the show now, your wife is going to be very happy about this. I promise you. I want to talk a little bit about women because it's not just for men.
Absolutely.
So what happens with women?
Well,
how do you treat women that, and we're not talking about testosterone here now, we're talking about other hormones, right?
Yes. I mean, there are more hormones involved when it comes to the female anatomy. However, we find a lot of the male patients, we have predominantly male patients. Why? Because they want to fix a problem. They have to fix it, and they're going to go and find out what needs to be done.
Average age.
Average age usually is between 30, 35, up to 55. Okay. But in the last 2 decades, we've definitely seen, younger men experiencing these symptoms.
Low testosterone.
Low testosterone, correct. So with females, it's a lot easier to treat.
Really?
It's just
now with them, females, it's estrogen now, right?
Well, no, that is one of the hormones that can be treated. However, we find that the first hormone that starts to decline is the testosterone.
Okay.
And a lot of women don't, they're too busy taking care of their boyfriend or their husband or their children or the house or the bills, and they come last. And so we sometimes see these, women come in when they're really well into menopause, and then we're trying to kind of backtrack. So the female patients that are taking care of themselves and they come to us at an earlier age, we're able to help them so much more. And it's very simple. With the male program, you have a lot of different medications in order to support the natural production of hormones. But with women, it's a lot easier. It's just a simple cream that you use every day.
No injections.
It's no injection for the females for the testosterone
That's
treatment.
That's not fair.
I know.
Not fair at all.
I know. We have to give birth.
Yeah, so that's true. That's true. So the topicals then?
Yeah, topical treatments. They're also oral. There are different types of programs for females, and it really depends on where their deficiency lies. But the first one to go is the testosterone. We need testosterone just as much as male patients do.
And what is the average age of your female patients?
They start seeing a decline usually around the 35 year mark. But like I said, because we're slower to kind of react to the issues that are going on with ourselves, we see our female patients come later, when they're well into
Renee
their
is going
40s.
through menopause right now. So she has the hot flashes. A little bit of weight gain. Did you hear that? I said a little bit. What would this do for someone who's experiencing menopause? Oh, and also sweating too is another thing she has.
Absolutely. Well, it depends on where the deficiency lies, what medications we're going to prescribe. The main three are the estrogens, the progesterone, and the testosterone. The testosterone mainly affects the energy, the libido. Progesterone can help with anxiety, can help with, resting better at nighttime, sleeping better, and overall, a very good sense of well-being. It just kind of releases mental fog. And then with the estrogens, that's going to help with the hot flashes and things of that nature. And we always review the patient's medical history, make sure exactly what their family history is, because that all plays in part of which hormones are prescribed.
I know the menopause drives Renee crazy, which means it drives me crazy. Her doctor said that the hot flashes, everything would stop after 2 years from the time she started. That was 6 years ago.
Yeah.
So women out there is a way, because listen, I feel so sorry for her, what she has to go through.
Yeah.
And it could be women in their 40s. Doesn't mean you're in your 60s or 70s.
Exactly.
But I hear more and more women talking about going through menopause and now seeing how long it lasts and what you women have to go through. So now here's a way, and you women are going to know this, if you're going through menopause, you don't have to suffer with it anymore.
No, absolutely not.
I'm going to give you the phone number. It's 844-438-4781. Now, you are nationwide. You have a clinic in Plantation.
Correct.
I'm telling you, it might sound far. It probably is. It doesn't matter. You want to make sure, because there's other people in town to do similar things. I'm telling you, this is not the time to Google somebody. That's what's so great about this show, that we can bring you someone. You don't have to Google anybody. And I'm going to tell you something. I want to go to the best.
Yep.
And I can tell you, after this is starting my 4th week, I am loving this program. I feel like I could actually, in fact, Dean had someone call me last week, and he said, how's it changed your life? And I thought about it, and I said, I don't know if change is the right word. It saved my life.
Yeah.
And that's really the way that I look at this. Because, if I'd have just let everything go, there's no telling. But my life has really changed. And again, I'm on a 3-month program, and I haven't even finished my first month yet. So I am so excited, and I'm always looking the next day. It's like, what new is going to happen? And like I said, the one thing, I have to get up very early. I've got a 8 o'clock in the morning radio show, 8 to 10 every morning, that's getting ready to go to 7 to 10. And Renee and I literally have to get up at 4 o'clock in the morning.
Yeah.
Now, I remember what it was like getting up at 4 o'clock in the morning before I started this program. Now, I'm getting up at 5 now, but I'm telling you, it's easy because my rest patterns are so great. So now they've come into your clinic now, and by the way, place is beautiful.
Thank you.
Very easy to find. And when they come in, they've given you their blood work. They've gotten a physical. What's next?
Just basically the doctor reviews their medical history, the lab, and the physical, and we determine a program based on their certain deficiencies and their goals that they're looking to achieve. And basically we put that program together for them, and it's all based on their affordability as well. There's varying price ranges depending on the programs we offer. So at that point, we send the medications to our specialty pharmacies. We only use the best pharmacies. That's another really good point about AAI. We don't use some of these, pharmacies that are not really operating on standards.
These over the counter that you don't know where it was made at, what kind of lab it was made in. I understand that.
When you're dealing with injectable therapy, you definitely want to make sure you're using a compliant pharmacy. So they basically ship the medication directly to the patient, and we can even send it somewhere discreetly. If you're working during the day, you want your package to go to maybe a FedEx hold center or something so you can pick it up on your way from work. We'll do that for you as well. And basically, our wellness advisors are there to walk you through exactly how to mix the medications, how to do the protocols, any questions that you have.
So the first time you come in, will you already have all your supplements and the
We usually
HGH?
we wait for the evaluation from the doctor, and
Okay.
then we send it to the patient directly. So we don't
Okay.
have any medications come on site.
So, but you will teach them how to give themselves the injection.
Absolutely.
Okay. This program, you guys make it so easy. And I was thinking, because there's a lot of health problems that you can have, that it doesn't matter how much you work out. Thyroid is one of them. If you've got a low thyroid, that's what I had.
Yep.
I could have worked out every day for 2 hours and it wasn't going to make a difference. But see, I never would have known that I had a low thyroid. You've given me the supplement that's going to take care of that. But here I could have been spinning my wheels at the gym, maybe trying to watch what I eat, and nothing happens. So you get discouraged, you get off your diet, you stop going to the gym so much. So this is a way that I think the blood work is so important.
It is.
Because you have to do
It's
it.
the number one thing, and patients very seldom get it done. We have to drag them in, and we make them be compliant. All our patients have to go for regular checkups so we can make sure that their levels are where they need to be. Any of these other clinics that aren't requiring you do that, I would be very wary. You want to have your blood work done, because that's going to let the doctor know exactly what's going on with you, so we can prevent, some of these chronic age-related illnesses.
Now, I got to tell you, we just had someone ask us just a minute ago, I've heard about the pellets. Now, I know what you're going to tell me, but I did a lot of research myself.
Okay.
I didn't read a lot of positive things about the pellets.
Yeah.
Why is that?
Because it doesn't emulate the body's natural production. First of all, we've had patients come to us where they've developed an infection around the site where it's implanted, and there's no real way to gauge that release of medication. So a lot of the patients coming to us were having these fluctuations, and they weren't really sure what was going on. So the injectable therapy or the cream topical therapy, that's the best way to emulate the body's natural production. You're going to get the best benefits that way.
Well, I was so glad when you said, no, we don't really believe in the pellets, because I'd read a lot of information, and I like the program that I'm on. And you ever had a problem and you made a phone call and they would put you on hold forever, and it was the most frustrating thing. What's so great about you guys is when you got a problem and you really want an answer right away, you're right there. I mean, I was so impressed. Every time I've called you, you've been there. I think one time, one of the other gentlemen in there, but you guys are always there for your clients. And that's not always so true. Even with your doctor, sometimes they take forever to get back with you. I know Renee's been waiting for her doctor to call her back for the last 2 days.
Absolutely.
Very frustrating. So with AAI Rejuvenation Clinics, you are there. Now, you're not going to be there at 3 o'clock in the morning, but we will be giving you Tina's phone number to call anytime after midnight.
I never turn it
Well, I'll do
off.
it,
You
Dean.
can see.
We give Dean's phone number.
There you go.
He doesn't do much. Again, if you'd like to, we're going to go to break. If you'd like to watch today's show, you can go to your website, which is www.AAIClinics, that's plural.com. I think you just got to scroll down. You'll see the screen there. You can actually watch today's show. The phone number there is 844-438-4781. For the next 3 months, you're going to be on the show with us, and I am going to do everything I can to get as many people on this program, because it truly has saved my life. We're going to go to break. I'll be back.
When it comes to age management, the name you can trust is AAI Rejuvenation Clinic. Their daily reviews rate them the highest in South Florida. AAI Rejuvenation Clinic is here to provide new and unique information about testosterone therapy that will further enlighten you. Increasing your testosterone helps you perform better in the bedroom, increases your strength, as well as keeps you more alert. By age 30, 93% of men have begun some level of testosterone declination. Don't wait until you have obvious issues before deciding to correct them. It's much better to reverse issues that have rooted over time. AAI Rejuvenation Clinic offers HGH injections, which will help you to lose weight, lower blood pressure, and give you that young overall feeling again. You can expect HGH injection therapy to return your metabolism to rates and speeds that you experienced in your youth. Feel free to contact one of their wellness advisors to discuss your questions regarding growth hormone, GH therapies, and whether they are right for you. Call now at 844-438-4781 or go to their website at www.aiclinics.com.
And we are back. We've been doing this show now for 4 years. We have all kind of experts. This is truly, we have a divorce attorney. I was divorced 20 years ago. We have an estate planning attorney. We have an HOA law firm. We have a lot of different shows that we do. We have a public adjuster show. This is truly my favorite show. I've never gotten involved personally with any of our shows, and we do 9 other shows across the country. So I am actually doing this program, and when Renee and I got into the radio business, we said we're not going to have any commercials, we're not going to have any shows for something that we don't believe in. Mm-hmm. And we would never have a show on like this, because I've had, since I've started telling people, because I'm happy about it, I want to share my success with, I've had people say, oh, I heard that's bad for you. Well, then I would say, well, why? Well, I don't know, I just heard. It's like, that's a crazy statement to make unless you know. So I'm the poster child. Mm-hmm. I'm actually going through this. I am starting, this is going to be the end of my 4th week. Now, when I drink water spouts out on my butt from everywhere. I've taken a lot of shots, but that was what I was worried about was, how do I give myself a shot in my stomach? Are you insane? Mm-hmm. I'm going to get shots twice a week in my butt? Yeah. That was my reason for that's not a good reason.
No.
So when I gave myself a shot the first time, now, of course, my hand was having a hard time because it was shaking so bad. And when I have Renee do it, I have her put on a little nurse's outfit, something real revealing, spike heels. And I wear my hush puppies. Those are the kind of things. But I really had nothing to be afraid of.
No.
So now I remember getting my first shots, my one in my stomach. I can do it myself. I don't know why I closed my eyes. How do you find where you're going to hit this? But it was so easy. I don't even feel it at all. Yeah. So don't let that be a reason. Now, Dean Locke, who's the owner of the company, him and Dana, what made Dean start this? Because he's in completely other businesses besides this.
Absolutely. Well, he became a patient, so he became a believer. And pretty much everybody at AAI is a patient. Our doctors are patients. All the staff has tried therapy at some point.
Everybody looks so good there. That's the reason.
All of us really believe in what we're doing. We've come from different fields where we didn't really believe in what we were doing. So there's this real passionate energy. We get along very well with each other. And, we extend that good energy to our patients. So they all feel it, and they're immediately put at ease because of that.
I'll tell you something that's a little weird. I guess I can share this with you. I go to Calvary Chapel every week. It's about 4,000 or 5,000 people there for the service. Mm. Sometimes I want to just get up on the stage and say, let's don't talk about God now. Let me tell you what this it's like something you want to share with others, because there's other people, because people don't talk about their health problems or health issues. Yeah. And we're not talking about some little pill now, okay? Yeah. I take probably 4 or 5 supplements every day. Mm-hmm. I have a day where I give injection in my stomach, and the next day I might not have any injection. Day after that, I have one in my, can I say tuchus on the air? I guess I can.
Yes, you can.
So, but it's a 7-day program. It's all spelled out so easy. Again, this is not just a weight loss program. You are going to lose weight from it.
That's just the benefit.
Yeah, that's just one of the benefits. Now see, my phone's not even on, but for some reason it does that. Shut up. It's probably someone wants to get on the program. Hey, if you have a question, we hear this is anti-aging. If you have a question, you can call us right now at 888-565-1470. I never had a question. It was like, I'm not doing the injections. So we've been going since the top of the hour, but I just want to tell everybody again, the first thing you have to have done is the blood work.
Absolutely.
It's pretty extensive.
Yes, it is.
They brought out 163 vials when they were going to do my blood. Wow. I was very pale when I walked out. I said, do you have any orange juice? No, but there was like 5 or 6 vials.
Yeah.
But I got back 3 pages of blood work.
Yes.
And it said, I have great news for you. It said, well, actually, I think it said, no, it actually said, I have bad news for you. It said, my stupid phone, I hate when they had the vibrations is going, oh, that's not even my phone. Something's vibrating in here.
It might be me.
But when I started when I got the blood work done and I got my blood work back, I was shocked because I don't drink at all. Never had a drinking problem. Went to University of Texas in Austin. Never, at all of our big parties, our frat party, I just never drank.
Yeah.
And I have a liver problem.
Right.
I also found out I have low thyroid. I also found out my testosterone was very low. So I found out things about myself I never knew.
Exactly.
A lot of people, I think, don't have this blood work because they don't want to know.
Yep.
What I don't know. So this makes you go out and find out if you have any health issues because you probably wouldn't have done it on your own.
Exactly. And it should be your primary concern without your health. Like, how good are you? How beneficial are you to your family to go out and work every day and be focused and produce as much as you can and not be stressed out and just feel better? Why do you want to walk around depressed and, you can't get the gains in the gym that you did before? So it's really life-changing. That's why we all really like working there.
It's could be very frustrating, again, because I have low thyroid, and I didn't know that. So it really didn't matter how much I worked out because until I fixed that problem, nothing was really going to help. So let's talk about diet now.
Okay.
So I like to have Kentucky Fried Chicken in the morning when I wake up. Usually, maybe a Big Mac. No, that's not me. So you also put me on a diet. Now, anybody who's ever been on a diet knows it's very hard to do a diet. It's very hard to keep it up, and because you don't get instant gratification. It's a slow process. So you gave me a diet, and it was basically eating less but eating more often. So that was pretty easy for me. But I got to tell you, because of taking the supplements, the injections, it's almost like I don't want to cheat. I don't want to. There's something mental about this.
Yeah.
So it's like I don't want to cheat. Now, with me, I'm so overweight, and like I said, I've lost 12 pounds in 3 weeks. I don't know of anything I could have done to lose 12 pounds in 3 weeks.
I know.
I told you I had a friend who owns a restaurant who wrote me. He said, I'll tell you how to lose that kind of weight. He said, just do 500 calories a day. Well, first of all, he could never do 500 calories a day. His are more like 5,000 calories a day. Yeah. But, that's not even healthy to do 500 calories a day.
No, it's not.
I don't want to lose weight that way.
Yeah, no, our doctors don't believe in that because even with those fad diets, they may work for a short period of time. But if you haven't incorporated this into your everyday so that it begins to feel like when you brush your teeth or wash your face, then you're not really going to reap the benefits for a long period of time. You definitely want to make it something that you do every single day, and it becomes a habit.
The diet does, and so does the workout. I'm working out now 5 days a week.
Awesome.
Because I want to. I didn't, God, I wish I could throw this phone out the window, but the window probably doesn't work. But it's actually from your owner, Dean, so we can't yell at that. It makes this eating program so much easier. It makes the workout easier, but it's mental. Does that make sense?
Absolutely, because your hormones are what regulate your body. So when your hormones are out of whack, everything else is. And if you're not treating that, then you're going to keep experiencing these symptoms and side effects. When you go to traditional physicians, they're ready to write you prescriptions for cholesterol medications, for diabetes, for, various cholesterol issues, things like that. And they're not really treating the root problem. So with your hormones, it regulates everything. So once you get that in check, everything is fine.
What happens, and you get to see the patients. Tell me the kind of benefits they're seeing from it.
Just amazing. We have a variety of different benefits that patients have received. It is very specific, so it depends on how long they've been without treatment, when they started it, and how much they needed to, recuperate. So really, the first benefits that you see is improved sleep. And I always tell everybody, if that's all that happens, that's good in itself, because once you start sleeping better, your body recovers. It's just you feel so much better during the day. You have more focus and energy. But that's one of the first things that patients see in terms of that.
Since this is the second half of the show, I want to share. I actually bought a pair of shorts. I was telling the first half, and I bought the size, same name brand I've always bought, and they were literally falling off of me. So I went back to the store, went back to 7-Eleven, and traded them in, got the next size down, and they're even a little big on me. So visually, I'm not seeing, I would like it to be more, but it's about patience too. This is a 3-month program. It doesn't happen overnight.
Exactly.
Now, what happens once, do you ever go off the program?
It depends which type of program you've put on. Sometimes there's a time where we have you cease medications. Your body needs some time to be able to produce the hormones on their own. So sometimes there's a period where you don't do medications at all, and there's different medications for times when you're off therapy, but not many. It's just a very limited. Actually, 2 medications that you have to be on for after the testosterone, but that's just a 2-week period.
So it's kind of like a maintenance program.
So basically, after that period of time, we'll send you in for lab work again, so that we can see where you're at.
I remember the doctor told me, I want to see, actually told you, I want to see new blood work in 2 months.
Absolutely. So when you reach
that
point,
to see that.
I know. So we'll send you before you're off the therapy so you can see where your levels are on treatment. And then we'll also send you when you're not on the therapy so you can see the difference. And then that we can gauge your dosage.
With testosterone, after the program, will it go back down?
It depends on the patient.
Okay.
Some patients maintain a level and some do not. It all depends on where their deficiency is being caused from. If there's a lot of toxins in the body and there's a lot of other factors that are playing into why the body's not working optimally, then yes, sometimes they need a longer treatment. It really depends on the person.
When someone comes in and they're going, I'm not losing the kind of weight, I know you're going to get to the root of the problem.
Exactly.
What's usually the problem?
Usually,
diet or workout?
Sometimes it's the diet. A lot of people think they're doing the right thing, and they're really not. It can be something simple by like using too much oil when they're cooking. That can make a really big difference in the calorie intake in a day. So little changes can really make a big difference in terms of the weight loss.
I used to tell people when they come sit down, because I didn't just put them on a diet. There was a lot of, like you, there's a lot more to it. So I'd say, Pam, the spray, says it's 0 fat.
Yeah.
But if you read the back, that's if you squirt a half a second. Now, who squirts Pam a half a second? You're like doing this, and all of a sudden, there is fat. And here you thought you were doing something fat-free, because you have to look at, and a lot of times you think, oh, the calories are low, but they don't look at the sugar, and the sugar is way up. So there's so much people do not understand, do not know. You do customer service, you do it well. We're going to come back, we're going to go to break, and we've got our last quarter. See, this was easy. I told you. Because you live it and breathe it every day.
Yes.
I mean, so this is like your baby. So it's easy. Someone says, tell me about your kids. I don't need to look at anything. I know exactly. The phone number there is 844-438-4781. Check their website out at www.AAI Clinics, that's plural.com. We'll be right back.
When it comes to age management, the name you can trust is AAI Rejuvenation Clinic. Their daily reviews rate them the highest in South Florida. AAI Rejuvenation Clinic is here to provide new and unique information about testosterone therapy that will further enlighten you. Increasing your testosterone helps you perform better in the bedroom, increases your strength, as well as keeps you more alert. By age 30, 93% of men have begun some level of testosterone declination. Don't wait until you have obvious issues before deciding to correct them. It's much better to reverse issues that have rooted over time. AAI Rejuvenation Clinic offers HGH injections, which will help you to lose weight, lower blood pressure, and give you that young overall feeling again. You can expect HGH injection therapy to return your metabolism to rates and speeds that you experienced in your youth. Feel free to contact one of their wellness advisors to discuss your questions regarding growth hormone, GH therapies, and whether they are right for you. Call now at 844-438-4781 or go to their website at www.AAIClinics.com.
We're back. I'm here with my representative of AAI Rejuvenation Clinics, Tina Montoro. It's a Jewish name, right? Japanese.
Absolutely.
Which were your family in the dry cleaning business? Anyway, the phone number there is 844-438-4781. I am actually on the program. I took my injection today. I did all my supplements. Let's talk a little bit about the supplements because that's an important part of the program also.
Absolutely.
It's not just injections. It's not just the workout. It's not just the diet. There's supplements. And I take, I would say, probably 4 different supplements. I mean, one's for my thyroid. I've got, I guess, one's for my testosterone. It's so easy. I mean, because some people don't like taking pills. These pills are so easy to take. Tell me some of the different kinds of supplements that you use in your program.
Okay, gotcha. Well, one of the very popular ones that we use is called DIM, and that basically is to help the body's support of androgens, because when we're injecting testosterone, the body converts it to estrogens. Now, in the program, we provide supporting medications that's supposed to mitigate that. However, we feel incorporating the nutraceuticals to work on a natural level, that really maximizes the benefits and helps the program work better. We have a lot of patients come to us that their doctor thought they were doing them service and kind of gave them testosterone by itself and didn't put them on any supporting medications, no nutraceutical options. And they're all, their estrogen's really high, and the body's not able to really use the testosterone that's there just because they weren't put on the right combination. So we're able to correct that problem, and that's the importance of using the nutraceuticals, because they're plant-derived, and it's replacing the body's nutrients that we don't get in the food that we, are buying today.
What I like about your supplements, these aren't the kind you go to Publix to buy. These are what I would call pharmaceutical supplements.
Absolutely.
So you have the best of the best, and I thought they're not that expensive at all. I was really surprised at the price, being how powerful they are. And this is all done under a doctor's supervision. You've got 2 or 3 doctors that actually work at the clinic that are very much involved in your program. I mean, it's not just some clinician that's putting you on a program. And knowing the owner like I do, Dean and Dana, they're going to have the best of the best. And I have actually come into the clinic several times, and first of all, you've got plenty of employees there, but they're all so knowledgeable, so nice. I mean, it's like, Dean, I know customer service is very important to him. And I'm going to tell you something, when you get on this program, the customer service is very important, especially the first week to 10 days. Because you might feel like, now, wait a minute, is this the right needle? And is this the right, because there are, I'm 7 or 8 different things. And the first week, I got to tell you, I don't know if it's my age or what, but it's a little confusing. And I was calling you up, and you were always right there. And you would say, no, I want you to do this and this. And I had questions that I thought they were stupid. I don't know if they were or not, but you were such a big help. And I think that's so important that you don't just put someone on a program and see you.
Yeah.
It's like we're there for you. And I love the customer service of how
Absolutely.
the company runs. The company is called AAI Rejuvenation Clinic. They're in Plantation. Now, if you're out here in Palm Beach, you're like, it's too far to go. I'm going to tell you something. I would rather you go a few extra miles to a place that I know, that I recommend, than going someplace that you don't know much about. I always say this show is you don't have to Google. We've already done that for you. And I trust this company so much. Well, I've actually put my life into your hands. And I think I was saying, Dean had a friend of his on, and he asked me a simple question. He said, has this changed your life? And the first thing that popped up is, this has saved my life. So it's really, I think it's wonderful that, because we have a lot of people listen to the show that are over 50, and they feel it. Well, you don't have to feel that way anymore. No. Can you imagine getting up, feeling rested? You're 65 years old. You feel rested. You feel good. You feel like you're ready to take the day on. You're losing weight. You can go to the gym and not have all those aches and pains. It doesn't get, the only thing that gets better than that is something else that does too. It costs me her Clydesdale now. but it's just how many things can change your whole life like this. So, I'm not trying to get sentimental. I would have done this with Dean on today, but gosh, you guys just saved my life. It has just made a huge difference in my life. So I'm going to put you on the spot.
Okay.
Like I haven't already. Tell people why they should come to your clinic more than anyone else's clinic.
Just basically because we really do care. We really do. We're not one of these clinics that is trying to sell you something. We are prescribing to you based on your need. And if you come to us and you truly don't have a deficiency or something we can help you with, we won't treat you. We will send you away. So we definitely care about our patients. We offer the best products, the best pharmacies, and the best service. End of the day.
When Dean had me talk to his friend, I don't even know who I was talking to.
Yeah.
If this was all about doing a sales job, he would have already done it on his friend.
Absolutely.
And he hadn't. And I thought that was really cool. You really do care. I try to get Dean to tell me something else, like I can trick him or something. It's like, come on, you can tell me that. Why'd you really do it?
Yeah.
And he says, it's like what it did for me changed my life. And I want others to feel the same way, because this business is totally different from his other businesses.
Absolutely.
But it's so great. And I know you don't have to be in your 60s or your 70s, because, like I said, I had someone who's 28 years old said their testosterone was low. I went, you're too young.
Exactly.
But there's a lot of us out there that are in our 60s, 70s, 80s, and we think this is what we're
have
dealt.
to accept it.
Yeah, we have to accept it. And you don't. There is a place. It's called AAI Rejuvenation. The phone number, please write this down. If you don't take care of this, you have only yourself to blame. The number is 844-438-4781. You could have gone to their website today, or you can go back and you can watch today's show over again. You can go to their website. It's www.AAIRejuvenationClinics, that's plural.com. Rewatch the show. Call them tomorrow morning, 844-438-4781. Let them, I don't want this to sound like a commercial, but it's like it's helped me so much.
I know.
That And I got to tell you, I don't know if I even told Dean, we're in 10 cities with Ask the Experts, not just here. And I have had actually companies call me going, we'd like to be part of your, I had a guy in Houston wanted to be part of Ask the Experts. And I'm going, nah, if I wouldn't do it, I'm not going to have a show on there like that. And I'm glad I didn't put them on because I've got you guys now. But in a way, I wish I would have because, I mean, last 10 years, I could have really used this. Because when you have sleep apnea, this is not a cure for sleep apnea, but I have a machine, but boy, does this help. I mean, with the machine and now waking up, I have never felt so good, so rested. And when you get up at 5 o'clock in the morning like I do to do a 3-hour radio show, a talk show, you better be on your toes. You have to be. I love what you do. I love what you do because you're so good at customer service. You never made me feel stupid. I think I know. I would
so many patients ask the same questions. You'd be surprised.
Well, sometimes you have the same question you had the day before. You know, and I'm a little ADD, so
it's new.
I was like, I don't really want her to think I'm stupid, but I don't understand.
Not at all.
And it's because I've got different needles. I've got different syringes, and you've got all these supplements here, and you look at them and go, whoa. Wow. And Dean told me, he said, you might get a little overwhelmed. I go, nah, bring them on, baby. I did. I got overwhelmed. And I would call you, and like I said, you always made me feel so welcome. So when you go to the program, you definitely want to ask for Tina. The name of the company is AAI Rejuvenation Clinics. They're in Plantation. Don't if you're here in Palm Beach, take the extra miles knowing you're going to somebody good. Thank you for coming on today. We're going to do this again next month. Okay. Hello, Dean and Dana. You sent a great representative in. We'll be back next week with more Ask the Experts. Thanks for listening today. Peace and love.
Thanks for tuning in today to the Ask the Experts show with Steve-O and Renee. Tune in every Friday from 4 to 5 p.m. while some of the top local experts in their field from Broward and Palm Beach counties educate you in the areas of law, health, financial, and home improvement. You can also call our offices at 888-574-6999 to become an expert on our show. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.